Welcome to Marrow Masters, sponsored by the National Bone Marrow Transplant Link, Insight Corporation, and our esteemed Link partners. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplants from diagnosis through survivorship. This season of Marrow Masters focuses on chronic graft versus host disease, or GVHD. Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Welcome, everyone. Today's episode will highlight best ways to manage the symptoms of chronic GVHD with products which are very accessible and often available over the counter at affordable prices. Viki Anders is a nurse practitioner and coordinator at the Graft versus Host Disease Clinic at the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins. Her vast knowledge and experience of 37 years, often complemented by her patients' 2 cents, as they navigate their individual journey, is comprehensive and always appreciated. Thanks for being with us today, Viki.
Oh, you're very welcome. I'm looking forward to doing this. So what I'm going to do is go through pretty much every organ system where you can have problems with graft versus host disease, starting with the most obvious, which is the skin and the fingernails. So the main thing with the skin is you want to keep the skin well lubricated. But the problem is if you go out and buy a pump bottle of lotion, like most people have, most of that is water. So when you put it on your skin, it's just going to immediately go away. So what we recommend is getting a tub of some kind of cream with as few chemicals and no perfumes in it. So those products would be in not your lotion section of your drugstore or your grocery store, but where they have the special creams that are a little bit more expensive, unfortunately, but they go further and they lubricate your skin better. You always have to remember that dry skin can trigger your graft versus host disease to come back or even make your current graft versus host disease worse. So keeping it well lubricated at least twice a day is important, and even more if you see that it's dry. My favorite dermatologist always tells me, if you don't feel greasy, you're not greasy enough. Next, I'm going to talk about the sun. So everybody is told, don't go out in the sun. The sun is bad for you. The sun can trigger graft versus host disease. Not true. Everybody needs a little bit of sun because the sun gives you your vitamin D. And we certainly didn't have you do a transplant to hibernate during the summer and warm months. So what is your enemy is not the sun, but a sunburn. A sunburn can kill you because what happens is any damage to your skin, even a sunburn, can trigger those lymphocytes to come and fix that damage, recognize your skin as being foreign, and give you a bad kind of graft versus host disease. So what we would like you to do is, especially in the warmer months or you live in the areas where there's sun, is to get a bottle of sunscreen, but don't worry about that number on there. What we want you to do is turn it over and look at the ingredients. And the best thing to get is something with either zinc or titanium in it. Those products will protect you against both UVA light rays as well as UVB light rays. We want also to not have as many chemicals as some of those other sunscreens use. So I would recommend going and, again, looking in the sunscreen area, but because most of the places now even have their own products with titanium and zinc in it. Put that sunscreen on 30 minutes before you're going to be outside. And if you're outside and sweating or in the water, every 2 hours, it should be reapplied. And if you're thinking about, remember I just told you to lubricate your skin twice a day. So if you put this sunscreen on as your morning lubrication all over your body, even under clothes, then you're done. And then all you have to do is put another kind of cream on in the evening. The other thing to think about is everybody should be getting skin checks at least once a year. And more than that, maybe twice a year, especially if you have had your graft versus host disease treated with light treatment, either PUVA or UVB light treatments. The skin cancers that we see after transplant are the most common secondary cancers. So it's really important if you see a suspicious lesion, or even if you don't, to have your skin checked by a dermatologist regularly. If your skin is active, it's best to use those topical ointments rather than creams. If your doctor is prescribing a steroid to put on your skin, ask them for an ointment, because the creams that have steroids in them, or even the tacrolimus in them, can dry your skin. So anything that is greasy, again, is best to be using. For itching, if you put ice on it or cold water, that can make you feel better with the itching. You can also ask your pharmacist to take your cream and put some menthol in it. The menthol feels very cooling when you put it on and can decrease the itching. Also, in your medicated creams and lotions aisle, where they have medicated ones, they have products that say for itching. So that would be something to try. On your fingernails, a lot of people with graft versus host disease get ridging of the fingernails. After your bone marrow transplant, everybody has a horizontal, a sideways ridge. That's your chemo line. That will grow out. Graft versus host disease looks the opposite. It's a vertical ridge. And the ends of the nails, the very tips of the nails, can get very brittle and crack very easily. So what we recommend, first of all, for fingernails is to keep them filed. I keep an emery board everywhere, in my car, every pocket, and every room of the house. And feel the edges of your fingernails. If they feel rough, use that emery board and just very gently make it smooth again. Also, if you have a broken nail, you can use a Band-Aid or a bandage to put over that so you don't catch it on something. And one thing that can help your fingernails not break is just a clear fingernail polish. Any kind is okay, but the ones with the fewest chemicals, the more natural ones, is better. Avoid any gel polish. You may think it's better because it lasts longer, but it will damage your nails, and that will make it even worse. And any fake fingernails are even worse. So it's okay to go, and if it's okay with your doctor, to get some gentle manicures, but just use the shorter acting kind of clear nail polish. If you're going to be doing any dishwashing or cleaning in your house, use rubber gloves. And what's a good idea is apply that cream to your hands before you put those rubber gloves on. The heat of your hands will help that cream to sink into your hands. And if you're doing any dishwashing, the warm water will also help the cream sink into your hands. At night, you can apply this cream to your hands and feet and cuticle oil to your fingernails and your toenails, and wear cotton gloves and socks to bed. And you'll notice when you get up in the morning that they feel much better. That's even true if you have been prescribed steroid or tacrolimus or any other kind of immunosuppressive creams, or, as I said, ointments are even better. If you apply them at night, it really sinks in, and it'll really help, especially those of you that have the palms of the hands that are so dry and cracking. Be very careful of the skin on your calves, your feet, your forearms, and your face. The skin is very, very fragile. If you are on steroids as a treatment for GVHD, you may notice that you get bruising very easily because the skin's so fragile. So we'd like for you to daily examine your skin on your feet and lower legs, especially because that's a place that you don't normally see. And if you see at the first signs of any kinds of wounds or abrasions, especially if you have the changes of sclerosis, which is the thickening of the skin, you need to tell your doctor right away. One of the things one of my patients recommended was go out and get a first aid spray at your drugstore. And at the very first sign of a scrape or an erosion on your skin, spray it with that. They say that that protects it and helps it heal very quickly. Also, if you have any cracks in your skin, steri strips, which are over the counter in your bandage department, you can put them on to keep them together. If your wounds get large, and especially on the calves, on that bone in the front of your leg, if you have any kind of sclerosis or swelling down there, you don't have very good blood return in order to be able to get those areas to heal. So when those lesions get big, you need to consult with a wound care clinic. There are special soaks that they can prescribe and special dressings depending on what your wound looks like. One more thing with the skin.
Okay.
If you have scarring of your skin or dark skin, which happens a lot with graft versus host disease, fish oil supplements can help lighten the skin, but fish oil supplements can always cause bleeding because it thins your blood. So make sure that you don't use any of these products without talking to your doctor. The products for lightening your skins have chemicals, so check with your doctor about that also. And anytime you're using any products that you haven't used before, check a small area of your skin, put it on. For women, the breasts are really good because usually that hasn't been exposed to sun. Do that 2 days in a row and make sure the area doesn't get red. The last thing you want to do is to put a new cream all over your skin, have your skin have an allergic reaction to it, and that could also trigger graft versus host disease.
Sure.
So I'm going to move on to the muscles and joints. So Peggy, do you have any comments or questions?
This is fantastic. It's going to be so helpful to so many people. And I think it is important that we stress that people should always be asking their doctor questions before attempting any of these products.
I totally agree. So I'm going on to muscles and joints now because that seems to be my patient's second biggest complaint. They complain about muscle cramping and joint pain and tightness and inability to move their joints. And that's one of the first signs of a very commonly missed kind of graft versus host disease called fascial GVH. Fascial GVH is the lubricating layer between the skin and the muscle. And when that gets involved, it can bind down to either the muscle or the skin or both. So your skin, instead of you being able to pinch it like you're supposed to, you can't pinch it, you can't move it, and those joints become very, very tight, almost feels like swelling. I had one patient come in a few weeks ago and say, my whole body has edema. And I thought, oh no, I think we have some fascial GVH here. So anyhow, we'll start with cramping. Have your doctor check your magnesium, your calcium, and your phosphorus. Now, your calcium is in your regular blood panel when they check your electrolytes in your kidneys and your liver. However, the magnesium and the phosphorus are not. So they have to be checked separately. Now, magnesium tends to be the one, especially if you're on tacrolimus, that if it's low or even low normal, can contribute to cramping. There are two different kinds of magnesium supplements. The most common kind that you get over the counter are magnesium oxide products. They can cause a lot of diarrhea. If you get diarrhea from your supplements, ask your doctor about chelated products. There are brands out there that are lower dose, so you have to take double, but it doesn't matter if it prevents that diarrhea. Also, vitamin E has been known to help with cramping, especially if you are on one of the medications to lower your cholesterol. But again, that's very important to check with your doctor before you use that. As I said, decreased range of motion, the decreased ability to move your joints is a very big problem with graft versus host disease. One of my patients said if she did her stretching exercises, she took one step forward. And then if she came to a day where she didn't do her stretching exercise, she took 2 steps backward. So daily stretching is very important. I know everybody has limited amounts of physical therapy and occupational therapy visits on their insurance policies. So it's not necessarily important to go to the physical therapist once or twice a week. But if you can go and get an evaluation, have them measure your range of motion. Now, people ask, what's passive range of motion? What's active range of motion? I get them mixed up too. The main thing is to get both of them measured. That's all that matters. And then have them give you exercises for range of motion as well as for strengthening. And then if you go back once a month and have them recheck and see how you're doing and then adjust your exercises. But the stretching is very important to do every day. Also, patients have told me that acupuncture has helped them with their cramping. Now, I'm sure a lot of you with your skin don't want to do something like acupuncture, but it's something to think about and all the alternative medicines that are out there.
Would yoga be a great way for people to get that strengthening and range of motion?
Absolutely. Now, one thing There's hot yoga and regular yoga. I would think about going to one of the gentle yoga classes. And number one, it's easier. Number two, it's more relaxing. But the hot yoga, you have to think about if you're on medications that could affect your kidneys, that you don't want to get dehydrated, and make sure when you're doing your exercising and your yoga that you're staying well hydrated. Also, another thing patients recommend to me is gentle massage. Now, make sure that your doctor's okay with this, because if your platelets are low, that wouldn't be a good idea. But massage, I wouldn't do any deep fascial because you don't want bruising. You don't want to do anything that's going to hurt your skin. But if you do some gentle massages, that can really, really help.
Sounds great, Viki.
Okay, I'm going on to the eyes. So even if you don't have graft versus host disease, just having chemotherapy and total body irradiation can cause your eyes to get dry. It's called Sika syndrome, or some people call it Sjogren's syndrome, which is an autoimmune disorder. But the main thing is that when your eyes feel dry or gritty, they need lubrication. Do not go out and buy a bottle of tears that you use over and over and over again. Two things are in them. There are chemicals so they don't get contaminated. And some of them that say get the red out have even worse chemicals that will help get the red out, but also with patients with GVH will terribly irritate the eyes. I've been doing this, as Peggy said, for 37 years. And I started noticing we were telling them to use a bottle of preservative-free tears. Well, they still have something in there to prevent the infection. And they were coming in, and I was thinking they were getting a flare of graft versus host disease in their eyes, and it wasn't. It was the eye drops. As soon as we switched to the single use, so the single use come in a box, and they come with little blebs, and you open them up, and you put the tears in your eyes. You can experiment with the different brands. Some of them have thicker drops in them. Some of them are thinner. Some of the store brands, unfortunately, don't have as many tears in there as some of the more expensive ones, but experiment with it. The ones that are thicker may give you more relief, but may blur your vision, but they're good at night. Also, especially if you're getting steroid eye drops, you need to see an ophthalmologist. You need to have someone look at the pressures of your eyes if you're using steroids in your eyes. They can cause increased pressures. Your ophthalmologist may also have other things that can help you with dry eyes. They can put little plugs in the drains called the puncti. There are 4 of them, 2 of them in the bottom in the corners of your eyes and 2 of them at the top. Sometimes they start with just putting 2 in the bottom. Sometimes they put them in all 4, and that may help. Also, I'd like to step back a little bit. Sometimes the first signs of graft versus host disease in your eyes is more tearing than you're used to. What happens with that is the productive tears start not being produced. And so your eyes, they're called reactive tears. And those tears don't really moisturize your eyes. So even though you're tearing a whole lot, your eyes may feel dry and gritty. That's the time to go see your ophthalmologist. There are also special lenses called Scleral Lenses. There's different brands of them that you have to be fitted for. Most insurance policies are covering these, but there are grants out there if they don't. And your eye doctor should be able to direct you to them. They are like great big contact lenses. And once you get fitted for them, you still have to put the drops in, but they continuously lubricate your eyes. I had a patient that was blind from dry eyes, could not open his eyes. And he would run on the beach holding on to his wife's shoulder. And when he got his scleral lenses, he said it was like a miracle because he could, for the first time in 3 years, see. So it's something that to our patients could be a miracle. There's also autologous serum eye drops that can be prescribed for you. What they are is they use your own blood to make eye drops, and that helps your eyes. There are also special glasses out there that decrease evaporation and will help any tearing that you're doing and any lubrication that you're putting in your eyes stay in there for longer. And once again, as with the darkening of your skin, omega-3 fatty acid supplements, fish oil supplements can help with dry eyes. However, just like I said before, fish oil can cause bleeding. And if you have low platelets, not a good idea unless your doctor says it's okay. So that's pretty much the information I have for the eyes.
Viki, I know the scleral lenses, we hear all the time from patients that they are making such a big difference in their lives and giving them their life back, a lot of their freedom.
It's definitely worth pursuing. If your insurance company says no to one, they may say yes to a different product. And it's really nice if you can find an ophthalmologist or even an optometrist that specializes in dry eyes. Here at Hopkins, that's what we have, is a dry eye specialist that all of our GVH patients go to.
Terrific.
Okay, now we're going to talk about osteopenia and osteoporosis. When you are on steroids, your bones will thin and you are at very high risk for osteopenia, which means you've lost bone mass, or even osteoporosis, which puts you at big risk for bone fractures. Also, steroids can cause avascular necrosis in joints, which usually the symptom of that is pain in one joint. So the one thing we recommend is both men and women, if you've had steroid treatment, should get a bone density scan or a DEXA scan and see whether you have any osteopenia or osteoporosis. Also, to prevent that is gentle weight-bearing exercise, even just walking. Once you have those results, your doctor can see whether you need the special medicines that can actually put the bone mass back into your bones. One of the things I would like to mention, though, with graft versus host disease, my next topic is going to be your mouth. If you're using an oral medication to put the calcium in the bone back in your bones, the directions are to stay upright for at least 30 minutes. We don't recommend the oral preparation of these products to be used because if you've had oral graft versus host disease, which can damage all the way down your esophagus, it's almost for sure that that's going to aggravate that. So there are IV preparations now that are much better for people that have had GVH.
Very interesting, Viki. How long have the IV preps been available?
Actually, for a couple years now. They do amazing work because I do bone marrow aspirates. Today was my day to do bone marrow aspirates. And there are certain diseases that get the different products to put the calcium back in their bones and to make their bones stronger because they're at risk for bone fractures. And it is so hard to do a bone marrow in somebody that's on these products because their bones get hard.
Sure.
Okay, now another area that I'm sure you all know that there's a problem with is the mouth. So again, just having a transplant can cause you to have a dry mouth. So that's a problem. And there are some saliva substitutes out there that could help. Also, sugar-free candy can stimulate saliva, but the ones that end in TOL, sorbitol and mannitol, they can cause diarrhea. So be very careful how many of those you suck on for your mouth. And biofeedback has also been shown to be helpful for dry mouth. But the main thing, the very first sign of chronic GVHD in your mouth is all of a sudden toothpaste will burn. People come into our clinic and that's the first thing we ask. Do you have any burning in your mouth to toothpaste, spicy foods, carbonation, or any kind of citrus? And almost all of them say yes to toothpaste and also to mouthwashes. Now that's an easy fix. It won't fix the GVH, but at least it won't burn. And we don't want to be causing burning in your mouth because that means we're promoting the inflammation in there. Go out and get a children's toothpaste with either bubble gum or fruit flavored. That won't burn. What is burning in your mouth is actually the mint. Some people say when they use the children's toothpaste, their mouth doesn't feel clean. That is because we are conditioned to saying after that blast of mint, oh, my teeth are clean. You don't need that blast of mint. Just the mechanics of brushing your teeth with a children's toothpaste will clean your teeth. And avoid mouthwashes with either mint or alcohol in them because they'll not only burn, they'll dry up your mouth. Lip gloss and lanolin ointment for lips. If you have graft versus host disease on your lips, if they look white and they're very, very dry and splitting, you may want to ask your doctor if you can use one of your steroid ointments on your lips. And there are also steroid swish and spits that you can use for the burning in your mouth and the discomfort in your mouth. There's also a tacrolimus swish and spit, but that needs to be formulated by a special formulation pharmacy, and sometimes they're difficult to find. One thing I would like to mention, anytime you're putting immunosuppression, steroid rinses, tacrolimus rinses in your mouth, you should also be on an oral antifungal to prevent thrush. Now, you may say, but I'm on a medication to prevent fungus. That will not protect your mouth when you're putting steroids directly on there. So we either use nystatin 4 times a day, swish and swallow, because remember that damage can go all the way down to your esophagus, or Miselex is another antifungal, but that needs to be used 5 times a day. If it's not used 5 times a day, it's not very effective. Also, dental visits are encouraged at least every 6 months, and some of our patients go every 3 months. Now, you want to ask your doctor if you're going to have a dental appointment, whether you need antibiotics before it. It's called endocarditis prophylaxis, which is to protect people with heart problems, but this is not to protect you from a heart problem. It's to protect those gram-positive organisms that are in everybody's mouth from getting into your bloodstream and causing an infection. So the decreased saliva in your mouth with graft versus host disease will increase your risk of cavities. That's why you need to see a dentist. Many dentists will say, I'm not touching your mouth with all of your problems after transplant, but you need to find a dentist that will. Fluoride treatments will help decrease the caries, and there's actually fluoride trays that you can get to use at home. The main thing is talk to your doctor first. Make sure they're okay with your platelet count. You should have more than 50,000 platelets before you get a dental visit. And make sure that whether they want you to be on the antibiotic prior to dental visits. Another thing I want to mention, you keep hearing me say the damage can go all the way down the esophagus. A lot of people have trouble swallowing with graft versus host disease. That could be from infection. If you have thrush or fungus candida on your tongue, that can go all the way down the esophagus. Trouble swallowing can also be because graft versus host disease can cause strictures and webbing down the esophagus. So sometimes we need to do endoscopies to look down the esophagus and see if there's infection. But if you're really having trouble swallowing and things are getting stuck, sometimes they like to do a swallowing study first and see how narrow your esophagus is. There are ways of dilating that esophagus by using a little kid's tube first and then going to a bigger and a bigger and a bigger tube. So that's something that you shouldn't ignore, and you could actually have problems and get a pill stuck down there, especially the big Bactrim pills. So definitely talk to your doctor if you start having trouble swallowing.
This is terrific. I just think how important it is to remind people to go to the dentist. And the interesting thing about the toothpaste, I would never have thought about children's toothpaste as an option. And that just is a terrific idea.
A little aside here, I've been doing this for a very long time. And back in the early 1990s, they didn't have many children's toothpaste like they do now. And I had a 21-year-old in college. And what he did is he went to the toy store and got Barbie doll toothpaste, and he put masking tape around it so his buddies didn't know he was using Barbie doll toothpaste.
Really?
But it worked.
Oh, that's great. What a story.
Okay, I'm going to move on to the lungs and the sinuses. So first of all, the most common area that we see infections are the sinuses. When I started doing this with the current doctor I work with, he used to laugh at me when I said, we better scan the sinuses. Their GVH and their mouth is flaring. And he's like, they don't even have sinus symptoms. But if you're coughing and it's a long chronic cough and your GVH in your mouth is flaring, think about the sinuses. I can't tell you the number of times where even without any nasal congestion, it'll show acute sinusitis. Chronic coughs, when you've been treated for a pneumonia and pneumonia goes away and the cough doesn't, think about the sinuses. And what you're trying to rule out is not chronic sinusitis because insurances won't pay for scans for that. You're trying to rule out acute sinusitis. The other thing is the lung GVH is not a very good diagnosis to get. because it can really affect your quality of life. And we like to catch it as soon as we can. And the first symptom is shortness of breath with exertion. So you should have a baseline. How much can you do without getting short of breath? Can you go up one flight of stairs? Do you get short of breath with one flight of stairs? Can you go up two flights of stairs? That should only get better, not worse. If you can now go up 2 or 3 flights of stairs, and then in a month, you can only go up one flight of stairs, 2 things need to be ruled out: infection and graft versus host disease. Of course, the first thing you do is rule out infection. They scan your lungs, make sure you don't have a pneumonia. But there are no real changes with bronchiolitis obliterans, which is considered graft versus host disease, on a CT scan. There is something called BOOP, bronchiolitis obliterans organizing pneumonia, and you can get that when you've never even had a bone marrow transplant. But that does show changes on your CT scan. So sometimes they actually have to go in there and do a bronchoscopy and find out, is this infection or is this BOOP? The bottom line is it's very important with pulmonary function tests, those breathing tests, CT scans, to get this diagnosis. The only way to really make a diagnosis is to do an open lung biopsy and get a nice chunk of lung, but we don't always do that, especially if your breathing tests aren't very good, because that's very risky. So what you want to do to promote lung function is routine aerobic activity. So if you're really, really sick, at least get out of bed, sit in a chair, don't lie in your bed all day. If you can, go for walks, short walks at first, longer walks after that. If it's summertime like it is now on the East Coast, you want to do it early in the morning, late in the evening. Remember, we don't want you to get dehydrated. There are things called incentive spirometers that you have all had. Using those can help open your lungs. Of course, smoking is not something you should be doing. And now in the days of medical marijuana, you have to consider that street marijuana has all kinds of fungus in there that you could get into your lungs and cause a very, very bad infection. So if you're using medical marijuana, it has to be with the prescription of your doctor, and you should not try to substitute that with street marijuana. Also, if you're using a humidifier, especially in the winter months when you have your heat on, that can be very dangerous if you don't clean it every single day. Sitting water can grow organisms like Pseudomonas. So when you get up in the morning, it needs to be emptied, it needs to be cleaned, and then you leave it out all day to dry out. And then you put new distilled water in that at night. So it's fine as long as you're keeping it clean. So that is my talk on the lungs.
Excellent.
Okay, now GI. We did a study at Hopkins looking at chronic graft versus host disease and gut GVH. And we looked back and said, did they really have GVH or did they have something else? And the gastroenterologist that did this study showed that more than 50% that we thought was gut GVH did not have GVH. There are many other things that can cause GI symptoms after transplant: pancreatic enzyme deficiency, bacterial overgrowth, lactose intolerance, and many other things. So it's really important to make that diagnosis. Don't go on immunosuppression thinking this is graft versus host disease. As an example, we had a patient referred to us that was 6 years after transplant. And we were being told that this was graft versus host disease. And every time he got down to 5 milligrams of prednisone, he got symptomatic. And when he went back to 10 milligrams of prednisone, the symptoms went away. So first of all, that doesn't make sense. You have to treat GVHD with more than 10 milligrams of prednisone. That's just a little bit more than replacement doses. The other thing is that there was a biopsy 3 years prior to this that the pathologist said could be GVH, but could be celiac disease. Guess what he had? Celiac disease. So again, make the diagnosis. Now, what we see more than GI symptoms with graft versus host disease is what we call a wasting syndrome. You can't gain weight no matter how much food you eat, and you have a lot of protein loss. The way to check that is to do a food diary for like a week. Everything you eat and drink, put that in the food diary and let a nutritionist look at that and see, are you really eating enough calories to maintain your weight? If you are, and you're still losing weight, then this could be the problem, the wasting syndrome. Then what you need to do is supplemental shakes in between meals, and you need to really work with your nutritionist to get the right kind of foods to optimize your nutrition, because it's very hard to get the calories in that you need. Taste changes. They can really affect your appetite and how much food you can get in. One of the things you can ask your doctor is to check about whether you can try supplements with either zinc, copper, nickel, niacin, or vitamin A. They can all help your taste. But what I found the most common thing that affects taste in my patients is thrush or Candida on their tongue. And we treat the Candida and their taste comes right back.
Wow. The food diary is such a great idea.
You really want to find out. Most people that we think have wasting syndrome do not. They're just not getting in enough calories.
And is that temporary, Viki? Will that subside?
If we treat the graft versus host disease.
Okay. Makes sense.
Okay. So now we're getting into the personal things. We're going to talk about the female genitals and the male genitals. So for the female, first of all, you need your GYN exams, especially if you're in early menopause, and it needs to be at least annually. So early menopause can cause vaginal dryness. Your chemotherapy can cause vaginal dryness. And there are certain lubricants that are much better than the over-the-counter ones. But you also have to make sure that you don't have infection down there. And we also see scarring in the vagina as well as just tightening of the vagina. Some gynecologists will recommend a combination of topical hormones and topical steroids with or without a dilator. So there's many things you can do for the symptoms you're having down in the vagina. If you're younger than 45 years old and go into early menopause, our endocrinologist recommends having hormone replacement. But again, that's something you need to talk to your oncologist about as well as your gynecologist about, because there are pros and cons to taking oral contraceptives after transplant. For the men, impotence is a side effect of chronic disease. So this could just be because you've had a transplant, because you've been through a lot of stress. But transplant can also cause decrease in the testosterone levels. So they should be checked. But when considering testosterone replacement, you want to be talking to endocrinology so they can check all of your hormones, not just the testosterone, and see how you're doing. The problem with testosterone replacement is that it can cause your liver functions tests to go up. So if you have a history of liver graft versus host disease, that may not be an option, or you may need more close monitoring. Be sure to mention to your team, your medical team, if you have any lesions on the penis or scrotum, because again, you're immunocompromised if you have graft versus host disease, which can cause a lot of secondary infections.
I would add that people really need to feel confident talking to their doctors and making sure that they're checking on all these things with the individualized doctors.
Now, the last thing I want to talk about is your mood changes and fatigue. So first of all, the most common treatment for graft versus host disease is steroids. We have new ones now out that have been approved by the FDA, but they're all for second-line treatment. The only thing since the 1980s that works to treat both acute and chronic GVHD are steroids. When you come off of steroids, we need to wake up your adrenal glands. So let me just explain here. When I wake up in the morning, my adrenal glands, which are behind my kidneys, spurt out some cortisol and say, okay, wake up. And then when I get my slump between 2 and 4 o'clock in the afternoon, it gives me a smaller dose of the cortisol to keep me going until nighttime. When we give you steroids, even low-dose steroids, we're putting your adrenal glands to sleep, and they have to be woken up again. So that's why we taper. That's why you can't stop steroids. I had a patient come in today that we've been dropping. We dropped her from 20 and then we went to 10. Again, this was over weeks. And then we dropped the 5, which should be replacement for a little tiny woman. And then we went to 4. And so we can check whether their adrenal glands are functioning by getting a morning cortisol level, which should be at least 6. And her cortisol level on 4 milligrams of prednisone was 1.9. Basically, she had no steroid in her body to help her function. And she was having terrible symptoms from that.
Wow.
So number one, an endocrinologist is the best way to do this if you start having problems. The signs of adrenal insufficiency are profound fatigue, bone pain, muscle pain, nausea. These things really get worse in the afternoon because remember, if you had, let's say your level was 6 in the morning, which is normal, will it give you some more steroid in the afternoon if your adrenal glands have been put to sleep? There's a special test to check for that called an ACTH stimulation test. So all of this can be done by your oncologist or by your primary care physician. But if you're really having problems with this, we really recommend an endocrinologist. So that can cause some of your fatigue. Just having chronic disease and having the chronic disease emotional ups and downs can cause fatigue, and depression can cause fatigue. We recommend that if you're having mood changes, if you're feeling depressed, especially if you're feeling suicidal, that's something that, because we're looking at all the medical problems, sometimes we don't address as much as we should. You need to be talking to your providers, even the nurses, the nurse practitioners, your physicians, if you're having mood swings, depression, anxiety. One of the things that can be checked is your thyroid. Many times after transplant, your thyroid stops working. So that's another just easy blood test. But in conjunction with all of these medical tests, we recommend talking to social workers, to psychiatrists, and it's okay to be put on an antidepressant. This isn't anything's wrong with you. It's not that there's something wrong with your mind or your brain. This is a chemical imbalance, and we can help that. So I think that it's very important to end with this, that it's okay to feel depressed. It's okay to wonder why you can't get back to being who you were before. And social workers are out there to help you. That's why we have groups like BMT Link. There are some support groups for chronic GVHD patients that you can meet other people with chronic GVHD and talk about your common problems. But the main thing is talk about it. Don't just keep it inside, and there are things that can help.
Excellent. Viki, this has been so incredible. Thank you so much for sharing your wisdom today.
I am pleased to do so, and I am so gratified for all of the wisdom that my patients have shared with me over the years, because probably 50% was their advice.
And that makes it so much more hands-on. I mean, to think that the patients are giving you this feedback and you just keep incorporating it into this incredible presentation. Thank you.
You're welcome.
This has been the Marrow Masters podcast. Feel free to share this episode via social media, text, or email. To hear more, subscribe for free to Marrow Masters in your favorite podcast app. To learn more about graft versus host disease and the resources available to patients and caregivers, check out the National Bone Marrow Transplant link at nbmtlink.org. That's nbmtlink.org, or just tap the link below in the show notes.